I still remember the sound of the monitors that early morning, the constant beeping, the frigid air conditioning, and the familiar feeling that time inside an ICU moves at a different pace, denser, heavier, more real. While most of the world sleeps, we doctors have learned to observe the silent miracle of life held together by invisible threads. Sometimes it's a machine that keeps the body functioning. Other times, it's something science can't yet name. My name is Rafael Moreira. I'm an intensive care physician, and I work in intensive care unit. I've seen things that made me believe in medicine even more, and others that made me question everything I learned from books. Because, deep down, there's a very fine line between what we call science and what many would call a miracle. I've seen patients with no chance of breathing on their own again, and I've also seen hearts stop for no apparent reason, as if they simply decided it was time to go. Life is unpredictable, and the hospital is the stage where it reveals itself, its rawest and truest form. But there are stories that stay with us forever. Cases that defy statistics, explanations, and, above all, the indifference that medical routine tries to teach us. The story I'm going to tell today is one of those. It tells of a man who was about to leave and a woman who refused to let him go. A story that made me understand that human touch, something so simple, so commonplace, can be the difference between life and death. I could introduce myself by listing titles, specialization, shifts, and surgeries, but none of that captures the true weight of working every day, pushing ourselves to the limit. What truly transforms us are stories. Stories like the one I experienced a few years ago, when a wife held her unconscious husband's hand and, in some way that escapes me to this day, managed to bring him back. Since then, I have learned that medicine is a bridge. On one side, the technical knowledge, the medicines, the protocols, the tubes. On the other, faith, love, hope. And in the middle of this bridge we are, trying to understand how two such different worlds can meet in a single human gesture. This channel was created for this purpose, to share real stories that science can't explain, but that the heart recognizes as true. If you believe that there are forces beyond the reach of machines, that love can be stronger than any diagnosis, then you're in the right place. Today, I invite you to sit with me and listen to this story until the end. It's not about a miracle cure, nor about revolutionary technology. It's about something older and more powerful than all of that. The connection between two souls who refused to be separated. And when I'm done telling you, maybe you'll see the touch of a hand differently too. It all happened on a rainy Saturday night, the kind of shift where time seems to stand still and tension hangs in the air as if the entire hospital were silent, waiting for something unknown. I was reviewing medical records when the high-pitched sound of the heart monitor shattered the calm. The heart of the patient in bed 12, Mr. Augusto, had begun to slow. I ran with the team to the room. He was a 58-year-old man, the victim of a massive heart attack, hospitalized for 3 days. His face was pale, his body motionless, and a woman sat beside his bed, holding his hand with an expression that mixed exhaustion and hope. It was Helena, his wife, and, I would later discover, the cool, silent protagonist of an event neither of us would ever forget. But before I continue this story, I need to ask you something important. This channel was created to share real-life cases like this, moments when medicine meets mystery, and the impossible seems to happen before our eyes. YouTube only delivers this type of content to more people if there is interaction. So, if you believe that miracles still happen, write in the comment, "I believe in miracles." I really need at least 100 comments for this story to reach those who need to hear it. And if you're new here, subscribe to the channel now and activate the bell, because what I'm going to tell you next could change the way you understand life, and maybe even love. Going back to that night, the monitor showed a jagged line. Augusto's heart rate was dropping, 45, 30, 20. The team prepared to begin CPR. I felt the weight of time slipping through my fingers. In an ICU, every second is a chasm between now and never again. But it was, at that moment, that something caught my attention. As the alarm rang out, Helena didn't move. She didn't scream, she didn't cry. She just tightened her grip on her husband's hand and whispered something that, from a distance, I couldn't hear. But I remember her look, calm, determined, almost serene. It was as if she knew something that we doctors didn't yet know. And then, the unthinkable happened. The monitor's line, which was already threatening to become a straight line, wavered, one beat, then another. The line, previously almost dead, began to draw a new rhythm, first weak, then stronger. The team looked at each other in silence, trying to understand. We checked everything, the wires, the electrodes, the equipment. Everything was fine, but his heart had started beating again. It was at that moment that I realized that this wouldn't be just another night on duty. Something extraordinary was happening, and somehow it started with that simple touch of a hand. If you're watching this video, stay with me until the end. Not just to know what happened, but to understand why this case forever marked my way of seeing human power over life. Mr. Augusto had been hospitalized 3 days before that Saturday. He arrived at the emergency room accompanied by his wife, gasping for breath, with intense chest pain and cold sweat running down his face. He was a strong man, the kind who rarely sets foot in a hospital and only accepts help when his body truly can't take it anymore. Helena, his wife, held his arm tightly as the nurses carried him to the emergency room. It was clear she already knew something serious was happening. There was love, fear, and a kind of silent surrender in her gaze, as if to say, "I trust you, but please, bring him back." Tests confirmed an extensive acute myocardial infarction. Augusto was immediately taken to the ICU for stabilization. We inserted a catheter, started medication, adjusted ventilation, and monitored every vital sign. During the first few hours, he responded well. His heart was weakened but stable. Hope began to dawn on Helena's weary face as she remained seated by the bed, knowing there was little to do but wait. In the hospital, we learned that there are 2 types of silence. The first is the technical silence, full of concentration, which precedes important decision. The second is human silence, the one that sets in when someone loves so much that they cannot find words to express their fear. Helena lived the second kind of silence. She didn't ask about survival rates or statistics. She simply observed her husband, sometimes caressing his hand with a simple gesture, repeated like a prayer. The staff gradually grew fond of the couple as well. Their love seemed to withstand the coldness of the environment. There was something there, an energy, a presence, that made that bed different from the others. Even amidst the monitors, IVs, and tubes, there was a kind of peace. See you Saturday night. That night, the rain started before sunset. The rhythmic sound of drops hitting the ICU window contrasted with the mechanical sound of the equipment. The shift was calm, and we all hoped it would be a peaceful night. But life rarely goes as planned. Around 10 p.m., Helena noticed something had changed. Her husband's skin tone began to pale, and his breathing became irregular. The monitor hadn't yet triggered the alarm, but she somehow felt it. She got up from her chair, called a nurse, and held Augusto's hand tightly, as if trying to stop someone from being carried away by an invisible current. When I arrived, the monitor was already showing a progressive drop in heart rate. Our training teaches us to act quickly, and that's what we did. We adjusted medications, checked oxygen levels, and reviewed circulatory support. But nothing seemed to stop the deterioration. His body was giving out. And while the team organized to begin CPR, Helena stood there, still, crying silently. I remember a nurse trying to pull her away, but she refused. She just said, "Let me stay. If he really goes, I want him to feel my hand." It was one of those phrases that cut through the air. And for some reason, I can't explain, I allowed her to stay. Maybe it was empathy. Maybe it was instinct. Or maybe something bigger wanted us to witness what was about to happen. As Augusto's heart sank, something in the room seemed to change. The air grew denser. The sound of the rain grew distant, and Helena, still holding his hand, began to murmur words that sounded like a mixture of memory and promise. At that moment, without anyone knowing, destiny began to be rewritten, not by machines, not by medicines, but for something invisible that can only be felt when love decides not to give up. The clock read 10:37 p.m. when the alarm went off. The piercing sound filled the entire ICU, that continuous beeping no doctor likes to hear, the sound of life fading away. The monitor showed a sudden drop in heart rate, 30, 20, 10, and then nothing. Assistance. At that moment, time stopped. The team moved automatically, nurses preparing adrenaline, the defibrillator being turned on, the air growing thick with anticipation. I looked at Augusto's motionless body and, for a brief moment, saw the faces of so many other patients who had crossed that same threshold. The line between here and beyond is thin, almost imperceptible, and it is there, at that threshold, that we learn the true meaning of helpless. Commencing. Maneuvers! I shouted. The compressions began, rhythmic, firm, precise. Every 30 compressions, we ventilate. Adrenaline was administered. The team's eyes reflected the same thought I was trying to push away. He's leaving. And meanwhile, Helena remained there. The team tried to push her away again, but she wouldn't move. She stood there, her hands clasped in her husband, her body bent over him, her shoulders trembling. Even in the midst of the chaos, I noticed something strange. There was no desperation in her eyes. There was presence. We continue. 1 minute, 2, 3, nothing. The heartbeat didn't return. Augusto's body was beginning to show signs of total collapse. Sweat was running down my face. Another dose of adrenaline? I asked, trying to stay focused. But inside, I already felt the weight of that impending loss. And it was then that, between one cycle of compressions and another, I realized that Helena was mumbling something. At first, I thought it was just the muffled sound of crying. But as I got closer, I could hear it. She said softly, "Baby, if you can still hear me, come back. I'm here. I didn't let go of your hand." Her words echoed in a different way. I don't know how to explain it. It wasn't a scream. It wasn't a plea. It was a calm conviction, as if she were certain she was being heard. I looked at the monitor. Straight line. That image always caused me a particular kind of pain. The definitive end, the silence of the heartbeat. But something inside me wouldn't let me give up. 1 more cycle, I ordered. We continue. The compressions made his body move mechanically. And, in this back and forth between life and absence, Helena squeezed her husband's hand tighter, as if, through that touch, she was trying to give him back, the way back. The time for resuscitation was already over 10 minutes. Technically, we were close to the point where we should have stopped. Science teaches us that, after a certain period of time without a response, the probability of reversal with quality of life is minimal. But there was something about that night, in that room, that wouldn't let me say the words I should have said already. Time of death. The team looked at me, waiting for the decision. But before I could say anything, Helena leaned over her husband and rested her forehead against his. He closed his eyes and took a deep breath. And at that exact moment, the impossible happened. The monitor, which until then had shown the "I hate" continuous line of absence, pulsed. A stroke, a sound, bip, then another, and another. The team turned around almost simultaneously. Augusto's heart, after more than 10 minutes of stopping, had resumed its rhythm, weak, irregular, but alive. No one said anything for a few seconds. Their eyes met, searching for an explanation that didn't come. We checked the cables, the sensors. Everything was in order. But the fact was, before us, his heart had started beating again at the very moment she touched him and spoke to him. The nurse beside me, her eyes filled with tears, whispered, "Doctor, did you see that?" We all saw. And in that moment, I realized that no matter how much medicine evolves, there are times when life responds to forces that science cannot yet measure. And the most impressive thing is that that was just the beginning. The real miracle was yet to happen. When Augusto's heart started beating again, no one moved for a few seconds. It was as if time had stopped inside that ICU. The beep-beep sound of the monitor, so often heard automatically, now seemed sacred. Each sound was an affirmation. He is here. I looked at Helena. Her eyes remained closed, her forehead still resting against his, as if unwilling to interrupt what was happening. The air seemed to vibrate in a different, almost palpable way. That kind of silence that precedes crying, laughter, or despair. A silence in which we all knew We were facing something that didn't fit in book. The next few minutes were pure tension. His heart rate was erratic, fluctuating between 40 and 90. His blood pressure fluctuated. A body that seemed to have gone too far was trying to find its way back. I ordered oxygen support and vasoactive medication adjustment. One of the nurse's trembling hands handed over the syringe, as if he doubted what he was doing. I could feel my heart racing, but my mind remained lucid. It was the kind of moment when medical instinct and the mystery of the EBE unexplainable merge, and you can only watch. Helena opened her eyes slowly. When he looked at the monitor, a tear fell slowly. She said nothing, just caressed her husband's face and murmured, "I knew you would come back." It was as if that certainty came from somewhere else, a knowledge that needed no proof. At that moment, he gave a slight movement with his fingers. It was almost imperceptible, but we all saw it. She leaned over him, crying, and called his name. "Guto, honey, it's me. I'm here." The monitor responded with another, louder beep, and then another, and another. The movements began to regularize, his body reacting gradually, as if each word of hers revived him more than any dose of medicine. The nurse to my left, in tears, squeezed a colleague's shoulder and whispered, "I've never seen anything like it, and neither do I. I've witnessed unlikely reversals before, but this was different." It was as if her touch and voice had created a bridge between worlds, between the body that was giving up and the spirit that still didn't want to go. And the more she spoke, the more his body seemed to respond. "He's coming back," said one of the technicians, and I just nodded, watching. The vital signs, which minutes before had signaled death, now told a new story. The heart, previously silent, reorganized. The blood began to circulate vigorously again. The pulse, previously absent, now became palpable. It was the kind of moment when even the most skeptical of doctors feels the weight of the invisible. And then, something even more impressive happened. Between the noises of the machines and the sound of mechanical breathing, we heard a moan, a hoarse, weak, but human sound. It was Augusto, trying to breathe on his own. His eyes, which had been closed until then, moved beneath his eyelid. Helena pulled away a little, surprised, as tears streamed down her face. He opened his eyes, slowly, disoriented, but aware. What I saw in that look, I will never forget. It was as if he had gone through something immense and come back different. He looked at her, then at me, and tried to speak. He couldn't form words. He just whispered, in a thin voice, "I heard you." The entire team looked at each other. Helena fell to her knees beside the bed, covering her face with her hand. I took a deep breath. Neither of us said anything. There was nothing to say. At that moment, I understood something that no academic training teaches. Human connection has a strength that goes beyond the limits of physiology. Her touch, the love in that gesture, had done the impossible, reversed the absolute silence of death. Later, we reviewed the entire medical record. No technical error, no delay in maneuvers, nothing that would explain the return. According to medical parameters, he should not have returned. But he came back, and the turning point was clear. The moment she held his hand and called him back. Since then, I have seen each patient in a different light. I understood that there is something about love, genuine, deep, that has the power to restore what is on the brink of breaking. And sometimes medicine just needs to allow that love space to act. The next few hours were a mixture of silence and disbelief. The team, who moments before had been fighting the inevitable, now looked around, trying to comprehend what had just happened. No one wanted to disturb the almost sacred atmosphere that had settled in the room. The monitors continued to beep regularly. Augusto's body responded well, and Helena remained there, holding his hand, now with a tremulous smile on her face. It was as if each touch was a way of reaffirming what she already knew. He's here. He's back. I stood beside them for a while, watching. That scene made me think about how many times, throughout my career, I've seen people leave surrounded by love, and others completely alone. And I began to notice a silent pattern. Those who set out alone seem to go faster, as if the emptiness around them is pulling them along, while those who are held by someone sometimes find a reason to stay. When I graduated, I believed that everything was a matter of statistic, calculus, and probability. I learned to trust charts, exams, evidence, but nothing, absolutely nothing, prepared me for what I experienced that night. There is a profound difference between healing and preserving life, and it was Helena who taught me this without saying a word. After stabilizing Augusto, we left the room in silence, giving the couple a moment. I remained outside, leaning against the cold hallway wall. The distant sound of rain continued, as if the world outside continued as normal, oblivious to the miracle that had just occurred. I felt a shiver run through me. It wasn't fear, it was reverence. Reverence for what I still don't understand, for what science tries to name, but that perhaps only the soul understands. About an hour later, I re-entered the room. Helena was sitting, still holding her husband's hand, who was now breathing with assistance, but already showing signs of full consciousness. She looked at me and said, with a calmness that disarmed me, "Doctor, I knew he wasn't gone. I felt he was still here." I was silent for a few seconds. I could have talked about delayed reflexes, about neurological stimuli, about residual physiological reactions, but none of that fit the reality I had just witnessed. What happened was not in the pages of any manual, and deep down, I knew science can explain the mechanisms of life, but not the will to live. The days that followed were a true lesson in recovery. Against all odds, Augusto evolved well. In less than a week, we removed the ventilator support, and when he began to speak, he asked to see Helena. She approached the bed, moved, and he looked at her as if he were seeing her for the first time, with a depth that only someone who has touched the limits of existence is capable of having. "You called me, didn't you?" he asked. "I called," she replied, smiling through her tears, "and I heard." This simple, almost whispered conversation had more impact on me than any medical conference. I realized that perhaps human consciousness goes far beyond the brain activity that monitors record. Perhaps there is something in us, a spark, a presence that continues to listen even when the body seems to have given up. At that moment, I understood that the story of Augusto and Helena was not just about an inexplicable return. It was about the power of connection, about how true love is, in a way, a universal language capable of transcending silence, fear, and even death. I returned home that night with a heavy but light heart, and for the first time in a long time, I looked up at the sky before going to sleep, not as a doctor, but as a human being, trying to understand the mystery of being alive. For the next few days, I visited Augusto and Helena every morning. There was something about that story that kept pulling me back, as if I somehow needed to understand what had really happened. Every time I entered that room, I found the same scene. Helena sitting beside him, her hands clasped in his. She barely spoke. She just remained there, present. And it was curious. When she was there, his vital signs improved. His blood pressure was stable. His oxygenation was balanced. His heartbeat was regular. When she left, the slight variations returned. It was as if his body recognized her touch as a sign of safety. One of the residents even joked, "Doctor, we should prescribe a visit from the wife every 2 hours." I just smiled, but deep down, there was some truth to that sentence. In medicine, we often treat the body as a complex machine, and it is. But we forget that the energy that moves it isn't just chemical. There's something between two human beings that defies measurement. A look, a memory, a touch. All of this can alter not only emotion, but also physiological responses. And there, in front of me, I saw it happen. It was the kind of healing that is not measured in tests, but in vibration. When Augusto was discharged from the ICU, I made a point of accompanying him to the exit. He walked slowly, leaning on Helena's arm, with a shy smile, as if he were still trying to understand why he had been given a second chance. Before he left, he told me something that stuck with me. "Doctor, I remember everything. I remember the sound of the machines, and then just emptiness. It was like I was in a place without time, without form. But then I heard her voice, and that voice pulled me back. I remained silent, just listening." He continued, "It wasn't a distant voice. It was like she was inside me. I couldn't see anything, but I felt the warmth of her hand, and that's what made me want to come back. That testimony, coming from someone who had been clinically dead for more than 10 minutes, struck me in a way that is difficult to describe. I've read similar accounts, seen studies on near-death experiences, on consciousness beyond the body, but living it, witnessing the impossible happen before your own eyes, is completely different. After they left, I stood in the hallway for a few minutes, watching the elevator close. At that moment, I felt a mixture of humility and gratitude. Humility in realizing that, despite all the technology, the human being is still an unfathomable mystery. Gratitude for having witnessed something that goes beyond any medical protocol. Later that week, I talked to some colleagues about the case. Some have tried to find physiological explanation. Perhaps the heart responded late to the last dose of adrenaline. Perhaps it was a coincidence. Others, more skeptical, preferred to call it a rare, spontaneous event. But none of them could talk about what we all saw. The exact moment Helena's touch coincided with the return of the heartbeat. And, curiously, no one doubted it. It was as if, even among doctors accustomed to living surrounded by logic, there was a silent agreement. Some things simply don't need to be explained to be true. I met Helena and Augusto again a month later at the outpatient clinic. She told me he had changed, calmer, more attentive, more grateful. And he said something I never forgot. "Doctor, I think we die a little every day and live again every time someone reminds us that we are loved." That phrase echoed in my head for weeks, because that's exactly what I witness every day, without realizing. In every look that asks for help, in every gesture of care, there is an invisible thread that connects two hearts, that of the patient and that of the doctor, that of the body and that of the soul, that of fear and that of hope. And sometimes it is this thread that decides whether the heart beats again. Since that night, I have learned something that is not taught in any college. Medicine saves bodies, but love saves lives. And the day we forget this, we will cease to be doctors and will become just flesh and blood. Technicians, tinkering with machines that will one day also stop working. Months have passed since that shift. Life at the hospital continued as usual. New patients, new challenges, new stories that required attention, quick thinking, and decisions that often had to be made in seconds. But despite the intense routine, Augusto and Helena's case remained fresh in my mind. Every time the sound of the monitors echoed through the ICU, a part of me went back to that rainy night, to that moment when the impossible happened. I started to notice subtle changes in myself. Before, I used to see the ICU as a battlefield, a place where life and death clashed silently, and the doctor was just the commander trying to maintain order in the chaos. After that episode, I began to see the hospital as a sacred space. Each patient, each heartbeat, each breath carried something invisible, a story, a bond, a force that, however discreet, could decide the course of everything. Some colleagues noticed my change. "You've been quieter lately, Raphael," a nurse said one morning. "Not silent, just listening better," I replied. And it was true. I had learned to listen not only to the sounds of the devices, but also to the silences between them, the pauses that speak as much as the noises. I learned to observe the look in a family member's eyes, the hand they hold, the contained sigh. These details, which had previously gone unnoticed, now seemed to me to be precious signs of what really mattered. Helena and Augusto returned to the hospital a few times for routine checkup. He was fine. He had resumed his life with a new serenity, a peace that was difficult to describe. We talked during one of these visits, and he told me that he had changed his way of life. "I used to race against time, doctor. I always thought life was too short to waste. Now I see that rushing is what robs us of time." Helena smiled when she heard this and added, "He learned to walk slower and to hold my hand more." That phrase, so simple, carried immense power. How many times do we fail to touch the people we love, to look them in the eye, to be truly present? In the hospital, I saw people struggling every day for a breath of air. And yet, out there, so many waste their lives running after things that, deep down, don't matter. Perhaps the true miracle was not Augustus's return, but what came after that return. the silent transformation that occurs when the value of a gesture is understood. And this transformation didn't just happen to them, it happened to me too. I started talking more with family members, allowing them to stay with the patients for a few more moments. I started encouraging small displays of affection, even in the most critical times. And, surprisingly, I noticed something curious. Patients got better faster. It wasn't a scientific rule, but an empirical observation. Human presence, touch, faith, all of these seemed to exert an effect that no machine could replicate. A colleague once asked me, somewhat skeptically, "Raphael, do you really believe that love heals?" I thought for a moment and replied, "I believe that love awakens the will to live, and it is this will that heals." Today, when I look back, I realize that that night changed the trajectory of my professional and personal life. I'm still the same doctor, rational, dedicated, passionate about science, but now I know that there is a space within medicine where the inexplicable lives, and it deserves to, be respected. Because there are times when the medicine is touch and the cure is a look. And there are people like Helena who remind us that love is not just a feeling, it is a life force. On that shift, I learned more about the essence of life than I had in years of study. And since then, I have carried with me one certainty. The hand that holds, sometimes, holds more than flesh. It holds destiny. Over time, I realized that Augusto and Helena's story doesn't just belong to them, it belongs to all of us. Every time I remember that night, I feel I carry a responsibility to tell people, to make more people understand that behind every diagnosis, there is something that medicine cannot yet measure: the power of human connection. I could have kept this story to myself. I could have left it lost among the many other cases that the hospital routine accumulates. But something inside me told me it needed to be told, not as a tale of miracles, but as a reminder. There are subtle forces at work when love is true. And perhaps, if more people knew this, we would see less hopelessness, less giving up, and more faith. Faith in life, faith in others, faith in the simple act of being present. In an age where haste rules everything and connection is limited to screens, it's easy to forget how important touch is. But I saw with my own eyes a heartbeat again when it felt the warmth of the hand of the one it loved, and it made me rethink what healing really is. Healing is not just removing the disease, it is rekindling what was dormant within the soul. Sometimes the body gives in because the spirit feels alone, and a gesture is enough, a word, a look, a hand, to remind this spirit that there is still something worth staying for. I know that many of you, watching this video, may be going through difficult times, some with family members hospitalized, others facing their own pain, loss, uncertainty. And I want to tell you something I learned from this story. You are never truly alone. Even when all seems lost, there is always a presence that can manifest itself when you least expect it. Sometimes through faith, other times through the love of someone who refuses to let go of your hand. I remember a conversation with Helena a few months after I was discharged. She told me something that I treasure. "Doctor, at that moment I didn't ask for a miracle. I just asked for him to feel that I was there, and I think that's what made him come back." These words transformed me, because what she called presence is perhaps the purest language that exists between human beings. No need for words, no need for promise, just truth. And it was this truth that crossed the space between life and death and brought Augustus back. As a physician, I continue to believe in science. It is the foundation of my profession. But today, I also believe in something that goes beyond the microscope and the scalpel. I believe that faith and love are not in opposition to reason. They are complements. A body can be treated with medicine, but the spirit needs to be touched by empathy, by humanity, by compassion. And that's what makes medicine an art, not just a craft. What I experienced that night taught me to see my patients differently. When someone comes into the ICU today, I don't just see numbers and graphs. I see stories, bonds, memories. I see someone who may be on the verge of death, but who can still hear, can still feel, can still be called back. So, if you're watching this video right now, I want to ask you something. Value the touch. Hug the ones you love. Look into their eyes, even when words fail, because you never know when that simple gesture can change someone's destiny. Maybe you're not a doctor, but the truth is that we all have, on some level, the power to heal. We heal when we forgive, when we listen, when we offer our presence, and sometimes that presence is all someone needs to keep fighting. So, before we finish, close your eyes for a moment. Think of someone you love deeply. Now imagine that this person can feel the warmth of your hand, the sound of your voice, the weight of your love. Understand, this gesture can bridge any distance, even the distance between life and death. After that night, many things changed in the way I saw the world, not just as a doctor, but as a human being. With each new shift, I realized that, behind the machines and protocols, there is an energy that unites us all, and that, when tapped, can transform even the most uncertain destiny. During my career, I have lost patients who fought bravely and survived, and others who seemed to have given up. But the case of Augusto and Helena taught me something that no statistics can translate. Sometimes, what separates life from death is the strength of a love that refuses to go away. And when this force manifests itself, even the impossible must yield. Helena was not a doctor. She did not administer adrenaline. She did not use sophisticated equipment. All she did was staying when everyone thought there was nothing left to do. And maybe that's exactly what life expects of us, that we stay, even when despair wants to push us away. Because sometimes, the simple act of holding someone's hand is the most powerful medicine there is. Today, years later, when I see the couple again for routine checkups, I still feel that same chill. They walk together, walking slowly, hand in hand, as if, unconsciously, they have learned that destiny can change when two souls decide to remain connected. And every time they thank me, I think that, actually, I'm the one who should be thanking them, because it was through them that I rediscovered the deepest meaning of medicine, and perhaps of life itself. When I leave the hospital at night and the cold wind touches my face, I often look at the city lights and remember, somewhere, someone is fighting for their life right now. And beside that person, there is always someone who prays, cries, or just holds a hand. This invisible presence is what keeps the world turning, silent but real. And that's why I believe that no gesture of love is in vain. Even if you don't see the immediate result, the universe always responds. If you've made it this far, I want to thank you from the bottom of my heart. This story isn't just about one couple, it's about all of us, about what we are capable of doing when we let love guide our actions. And if, in some way, it touched you, if it awakened something within you, then be part of this chain. Leave a like, subscribe to the channel, and write in the comment, I believe in the power of love. These comments aren't just numbers, they're words that resonate. Every time someone writes this, the message goes further, reaches more hearts, and maybe reaches those who need to hear it most. And, who knows, a simple video like this could be the helping hand someone is waiting for to get back on their feet. In the next videos, I'll share more true stories, some mysterious, some inspiring, but all true. Stories that show that medicine is made of technique, yes, but also of faith, compassion, and humanity. Because in the end, that's what keeps us alive. The ability to feel, to connect, and to keep believing, even when all seems lost. Close your eyes for a moment. Think of someone you love. Now imagine that this person can feel your presence, even from a distance. Hold on to that feeling, because that's what keeps life going. The invisible touch between two souls. And remember, sometimes holding a hand is holding a miracle. See you in the next video.